Good afternoon, everyone, and thank you for joining us. My name is Kevin Williams, and I'm the Acting Director of the NRC's Office of Nuclear Security and Incident Response. We are excited to welcome you to today's session, Rolling in the Future of Emergency Preparedness, or as Todd Smith would say, Rick rolling with emergency preparedness. Did I get that right, Todd? All right. So Todd coined that phrase, so just so you know. But before we begin, I'd like to share a few details on housekeeping in our Q&A portion. If you don't know by now, the Wi-Fi code for attendance is RIC 2026. Please remember to silence your electronic devices. All sessions are being video recorded. There is a QR code for the Q&A. It will be through electronic means, both through the virtual and in-person attendees. For those of you who are in the room, please take a moment to scan the QR code displayed on the screen to your device so you can participate in the Q&A during the session. So now you guys can do that. Do it at your leisure. For those of you joining virtually, you will find that there's a box to the right of your screen with tabs for the electronic Q&A and feedback. Questions from in-person and virtual participants flow into the same queue, so the questions received represent the total audience for the session. Today's session, we will be exploring a new era of emergency preparedness that is evolving to meet the needs of a rapidly changing nuclear landscape. Over the last several years, the NRC has been updating its emergency preparedness framework to better align with today's technologies and the possibilities that the future holds. Even with these updates, one thing that has never changed is our commitment to protecting the public. That commitment is at the core of everything we do. We have been in the emergency preparedness business for a very long time, and we continue to build on that expertise with fresh tools, new information, and smarter risk-informed strategies. Our speakers today will discuss established best practices in emergency response and new approaches that give us flexibility and scalability in our planning. Approaches that are designed to enhance safety by focusing resources where they are most effective. What is driving this change and this progress is a powerful combination of regulation, innovation, and collaboration, which is the theme of the RIC. Today's panel represents that mix incredibly well. We have invited experts who specialize in communicating risk clearly and effectively to the public, strengthening coordination across federal, state, and local partners, advancing the deployment and understanding of the next generation reactor technologies, and building international partnerships that help us learn from and contribute to global best practices. I would also include the tribal nations in that as we partner with FEMA and others to make sure that we are sharing that information and best practices. Together, they will walk us through how modern modeling, risk-informing methodologies, and an interdisciplinary teamwork are shaping emergency preparedness for the reactors of the future. The session is about more than regulatory updates. It's about how innovation and partnership are essential to creating a strong, more adaptable foundation for emergency preparedness moving forward. And I want to emphasize the collaboration piece of that. I always talk about, and I am going off script now, I do talk about my 3 C's of coordination, communication, and collaboration, and I think one of the most important piece here is the collaboration piece. So as you guys are here engaging people on emergency preparedness and other activities off the margins, I think building those relationships to lead to effective collaboration is what's going to serve you well. So partner with folks, and we wish you well in that endeavor. So now I'd like to introduce our panelists for today. Our first speaker is Dr. Angela Leak, a nationally recognized certified health physicist and radiological emergency preparedness leader with nearly 30 years of experience in radiation protection, regulatory oversight, and radiological response. Dr. Leak previously served as the Radiological Health Bureau Chief for the state of Iowa, where she directed all aspects of Iowa's radiation control program and dose assessments for radiological emergency preparedness and response. She is now the founder and principal health physicist of Quantum Radiation Solutions, providing strategic technical consultation to state, federal, and private sector partners across the radiological protection and response enterprise. She currently supports multiple state radiation control programs, the United States DOE, NNSA, university and national laboratory initiatives related to radiological response. Dr. Leak has represented the United States at international radiological preparedness workshops and conferences, including recently delivering the keynote address at the Emergency Preparedness Response Conference in Saudi Arabia. She has multiple publications in Health Physics Journal and contributed to the 2022 Oxford Handbook of Nuclear Security. She holds a master's degree in radiation health physics from Oregon State University and a PhD from Iowa State University, where her research focused on improving radiological emergency response through analyzing responder mental models on radiation and risk. Next, we have Dr. Adam Stein, Director of the Nuclear Energy Innovation Program at Breakthrough Institute. His work focuses on the intersection of technology, regulation, risk, and economics in nuclear energy. Dr. Stein examines how complex technical systems interact with regulatory and institutional decision-making, with particular emphasis on emergency preparedness, resilience, and decision-making under uncertainty. He has spent over 20 years in the energy sector as an engineer, researcher, and consultant, contributing to advanced reactor development, regulatory reform, and high-consequence infrastructure planning. Dr. Stein holds a PhD and a MS in engineering and public policy from, there's a lot to read here, but it's Carnegie Mellon University, where his research concentrated on rethinking emergency preparedness and response for nuclear facilities as an integrated technical and institutional system. He also earned an MBA and studied mechanical and nuclear engineering. Our next speaker is Dr. Richard Maurer, a nuclear scientist with the Department of Energy and the National Nuclear Security Administration's Remote Sensing Laboratory at Andrews Air Force Base in Maryland. Dr. Maurer has been involved in nuclear and radiological emergency response operations for more than 30 years as part of the United States National Emergency Response Program. He also developed and leads training and workshops on radiological emergency response for international partners around the world, and he also was a participant in emergency preparedness in Saudi Arabia. Finally, we are joined by Dr. Todd Smith, the Senior Level Advisor for Emergency Preparedness and Incident Response in the Office of Nuclear Security and Incident Response at the NRC. Dr. Smith previously served in the Policy and Oversight Branch, where he helped develop emergency preparedness policies, regulations, and guidelines for NRC licensed facilities. He also conducted research to advance the state of practice in radiological emergency preparedness. Before joining the NRC, Dr. Smith served in the United States Navy as a submarine warfare officer. His assignments included chemistry and radiological control assistance, naval reactors, lead engineer for Advanced Reactor Digital INC, engineering department head and special assistants for radiological emergency planning at Submarine Group in 10 in Kings Bay, Georgia. Dr. Smith graduated from Purdue University with an MS and PhD in nuclear engineering, specializing in thermohydraulics and reactor safety, and holds an MS in radiation health physics from Oregon State University. Now I'm delighted to transition into the heart of today's session. To begin, we are fortunate to hear from someone whose expertise and leadership have helped shape radiological emergency preparedness across the country and around the world. Please join me in welcoming our first speaker, Dr. Andrew Leak. Dr. Leak, the floor is yours.
Thanks so much, Kevin, and thank you all for being here. It's truly a privilege to be here with all of you today who are colleagues with the responsibility of ensuring that preparedness for all types of nuclear reactors is not just technically sound, but also coordinated, credible, and trusted by those communities that we serve. Emergency preparedness is not something that lives in a binder or a regulation. It lives in relationships, in shared experiences, and in conversations between federal agencies, the nuclear power industry, state agencies, county emergency managers, public health leaders, hospitals, first responders, and the public. And we're having those conversations today in a time of change. We are seeing new reactor technologies emerge. We are discussing modernization and graded approaches. There are conversations about scalability, efficiency, and the future of nuclear energy deployment. And these are all important and necessary conversations. But underneath it all is something even more important: emergency preparedness. Emergency preparedness is not just about managing projected dose. It's about sustaining trust and ensuring coordination in a complex, all-hazards environment. Because if a radiological incident ever occurs, it will not occur in isolation. It will happen during a storm. It will happen during wildfire season, or during a public health crisis, or during a period of strained infrastructure or limited staffing. And in that moment, the radiological component will be only one part of a much larger picture that state and local partners are already managing. Our radiological and nuclear emergency preparedness system has to function inside that broader reality. So let's look at a few real-world examples that we can learn from. So my first example is from Iowa. In August of 2020, the state of Iowa experienced a derecho, which is a thunderstorm system with sustained hurricane-force winds across hundreds of miles. The storm devastated large portions of the state. Power grids collapsed, communication systems failed, hospitals were on backup generator power, and emergency dispatch centers were offline. And keep in mind that during this time, we had a global pandemic underway that was already stressing emergency management and healthcare systems. These extremely high winds from the storm also caused the cooling towers at Duane Arnold Energy Center, the nuclear power plant, to collapse, as you can see on the screen. This resulted in the declaration of an unusual event, which, as we all know, means there was no release or radiological risk. And if you look at those images, you can see how if the public saw that and knew that was a part of the nuclear power plant, that they could really have some triggered fear in even the response agencies, let alone the public. But they didn't. There was no panic about radiation. It was barely mentioned at all. There was no shift of focus away from the immediate dangers of the downed power lines, the blocked roads, and the disrupted medical care. And the reason these damaged cooling towers did not trigger an over-response or a dramatic spread of misinformation was not by chance. It was due to the community's familiarity with the nuclear power plant, which was a result of decades of coordination and work that built trust between the facility and the communities they were in. And this occurred long before the storm. State and local emergency managers understood what safe shutdown looked like. They understood the communication pathways and how they would be notified if something was needing to be concerned. They had exercised scenarios like this, and they were comfortable explaining the situation to the people in their community. So when the plant declared the unusual event and the facility was safely shutting down, and they said that the residents should focus on the storm damage and keeping themselves safe from that, the message was reinforced by local authorities, not questioned by them. That reinforcement mattered. It showed that radiological preparedness had been embedded within the all-hazards response system. It was not treated as something separate or mysterious. It was just one piece of a coordinated response. And that's what emergency preparedness does when it works well. It quietly builds the confidence that allows proportionate decision-making during a crisis. Now, Fukushima Daiichi, that accident that was caused by an earthquake and tsunami in Japan in 2011, it provides us with a different lesson. The natural disaster there also devastated entire communities. Infrastructure collapsed, healthcare systems were overwhelmed. But in this case, there was an actual nuclear power plant accident layered onto that devastation. Evacuation was implemented broadly for a variety of reasons, some of which were radiologically driven. And in some cases, the evacuation itself created serious health consequences, especially for medically fragile populations. And Fukushima reinforced something we all know, but sometimes struggle to operationalize. Radiological reference levels guide decisions. They do not capture every risk present in a complex disaster. Dose models do not measure transportation or infrastructure collapse. They do not measure the fragility of hospitalized patients. They do not measure the exposure to extreme weather or the trauma of displacement. Protective action decision-making must be informed and balanced across all of the risks, not just radiological. And those risks are understood by state and local emergency managers because they know their communities and they live in the all hazards world every day. If radiological preparedness is not integrated into that system, if those partners are not a part of the planning and the discussion, then we risk making decisions in isolation. Integration is not optional, it is foundational. And my final example is from the earliest months of the COVID-19 pandemic during the spring of 2020, when the high mortality rates in the elderly population were being reported. 2 states, Iowa and Connecticut, pondered a difficult issue. In these 2 states, along with many others, there is a technically default protective action to move long-term care facility residents early in a nuclear power plant accident, often at projected doses as low as 0.01 sievert. So these 2 states considered, if a radiological emergency were to occur during this time, would the radiological-driven protective action of relocating long-term care facilities cause more harm than benefit? And the short answer at that time was yes. In those early pandemic conditions, evacuation of those elderly populations could have created an immediate mortality risk, and for not only the elderly patients, but also medically fragile residents. So those states temporarily adjusted the threshold at which evacuation for those populations would be considered, up to 0.5 sievert, projected dose for those populations, in order to balance the radiological risk against the serious infectious disease risk present at that time. This was communicated and proceduralized as a memo and shared across state and local decision makers to ensure they would be prepared for this discussion if it needed to occur. And these conversations happened before any radiological incident or emergency was occurring. They involved emergency management partners and public health leaders. Because once you're in the middle of a crisis, it's too late to begin explaining why a familiar protective action that's existing in plans for decades is not the safest one. Preparation is not just about equipment or plans, it's about shared understanding. So all of these examples provide considerations that are especially important as we discuss the future of emergency preparedness, advanced reactor designs, and graded approaches. The analysis of new technology implementations may reasonably conclude that the need for off-site protective actions, such as evacuation or shelter in place, would be unnecessary given the dose calculations for reasonable release scenarios. These analytical approaches are technically sound, but they do not fully account for the real need for state and local response agencies to prove that there was no impact, such as measuring background measurements. They do not address the explanation of any measurable radiation levels that might be present above background. And they do not address the explanation of why there is an incident happening at the facility. The public and the responders will have questions, no matter the size of the facility or the extent of the release. And this is why emergency preparedness coordination remains essential. Preparedness is not defined by whether evacuation or other protective action occurs. It's defined by whether the system is ready to assess the situation, to communicate clearly, and to explain decisions with confidence. Public trust is not built on the probability of a technical need for a protective action, but it is built on visible coordination and understanding of the totality of risks. If conversations about how new technologies work and the specific information that's feeding new risk assumptions happen only between regulators and licensees and do not include state and local partners, we create a vulnerability. Not necessarily a technical one, but a communicative one. When state and local partners understand the release and design bases for low-risk conclusions, when they are part of the graded approach discussion, and when they have the opportunity to practice critical communications, they become trusted voices who can reinforce proportionate messaging to the public and local decision makers. They can confidently tell their communities when no protective action is necessary. They can amplify the message of low risk. They can embed radiological response within their broader emergency management systems. And preparedness conversations are not an admission of danger. They are demonstrations of shared responsibility. As we roll into the future of emergency preparedness, especially in the area of new innovation, the question is not whether we maintain emergency preparedness, it is how we apply it to this new paradigm. How do we ensure that radiological preparedness remains fully integrated into the all-hazards system? How do we ensure that state and local partners are not just informed of the basic information, but truly engaged, providing insight to what their communities will need to fully understand and trust the risk assessments related to new technologies? How do we make sure that public messaging, especially when we're communicating about low risk or assuring that there is no need for a protective action, is delivered by voices in the community that the public trusts? Trust is not built during the incident. It's built in conversations we choose to have long before one occurs. So we can ask ourselves the following about the future of radiological emergency preparedness. Does it feel coordinated, open, and shared? Do communities, responders, and decision makers feel heard and that their best interests are in mind? And if the answers to those emergency preparedness questions is yes, nuclear energy moves forward with a strong foundation and even more momentum than what is already underway. So let's continue to expand these discussions to ensure that as nuclear technology evolves, the coordination, communication, and trust that underpin the foundation of emergency preparedness evolves with it. Thank you, and I look forward to continuing the conversation today.
All right, thank you, Dr. Leek. We look forward to continuing the conversation. We also appreciate you for pointing out how imperative it is to understand the radiological risk versus those who are in special population folks. I think that is good. We thank you for your leadership there. And if you didn't notice, Dr. Leek has her own 3 C's as well. And I think I wrote them down: communication, coordination, and confidence, with a focus on trust. Now to continue our discussion, I am pleased to introduce our next speaker, Dr. Adam Stein. Dr. Stein brings a deep understanding of how technology, regulation, and risk intersect with the nuclear energy landscape, and he's been a leading voice in rethinking emergency preparedness for advanced reactors. Dr. Stein, the floor is yours.
Thank you. Hello, everyone. Thanks to the NRC for having us here today. I really appreciate the opportunity to discuss this with everyone. Today, I want to talk about emergency preparedness as a design and decision problem. Traditionally, EP has been treated as a compliance function, a set of procedures, timelines, and thresholds that get applied once an event begins. But emergency preparedness is really the decision interface between plant performance and public protection. It's where the technical realities of the plant intersect with human behavior, infrastructure, and protective action choices. And as the regulatory framework evolves towards risk-informed and performance-based approaches, EP needs to evolve as well. Emergency preparedness should be treated as a decision architecture, something designed intentionally to produce robust decisions under uncertainty. Emergency preparedness sits at the point where plant conditions translate into protective actions that affect the public. Because of that, EP needs to explicitly define what the objectives are, how trade-offs across these objectives are handled, and how decisions perform under uncertainty. This matters especially now for a few reasons. First, advanced reactors are being or considered to be deployed in different contexts, different designs, different siting assumptions, and different operational profiles. Second, the Commission's updated mission now explicitly includes considerations of benefits to society. This has not previously been considered directly in EP or in many other regulatory contexts. And third, the petition for rulemaking 50-123 proposes a principle that protective actions should do more good than harm. We acknowledge that protective actions have both benefits and costs. EP becomes a multi-objective decision problem. That requires a decision framework capable of evaluating those trade-offs explicitly. A little bit of context for the regulatory backdrop of where we are. Emergency preparedness has actually been on the leading edge of regulatory modernization. The changes to emergency preparedness in 10 CFR 50.160 introduce an alternative performance-based framework for small modular reactors and other new technologies. This changed before most of the current regulatory changes that are being considered were even envisioned. It includes concepts such as scalable emergency planning zones and hazard analysis of nearby facilities. The proposed Part 53 framework also begins moving towards a more integrated approach. But in practice, EP is still largely treated as a separate objective rather than something integrated into the broader safety case. In other words, the regulatory framework has hooks for modernization, but the underlying architecture still reflects legacy assumptions. To illustrate that, we can look at this conceptual barriers to defense in depth. Historically, emergency preparedness has been added at the end of the safety framework. If you look at the traditional defense in depth model, it sits as the final layer. It works reasonably well in a deterministic regulatory structure, but it also creates a pattern where plant design, safety systems, and siting decisions are largely established before EP is fully considered. That results in EP often becoming an appendix to the decision-making process rather than an integrated performance objective. Instead of designing the system with EP in mind, we end up adapting EP to fit the decisions that have already been made. Deterministic models rely on simplified assumptions and fixed thresholds. This was very important in the early days of nuclear energy when we didn't have data or modeling capabilities to take a different approach. And that does work still for some engineered systems, but it has limitations when applied to emergency response. For example, hardline guidance combined with very short decision windows can produce responses that are actually less informed, not more. If the inputs do not match the assumptions that were made in the decision-making process early on, for example, as Dr. Leek mentioned, when you would even consider an evacuation, they can artificially limit the solution set that you're even considering. You're bounding your decision process in a way that excludes potential more optimal answers. Another challenge is that people do not behave like components of a fault tree. Human response does not produce a discrete outcome with well-defined probabilities. People are not pumps. They're free agents. We need robust decisions after exploring the range of uncertainty. That means that emergency preparedness is not a PRA fault tree problem. Siting decisions fundamentally reshape emergency response. Historically, many nuclear plants were located in relatively remote areas. Future deployments may and probably will look different. New reactors could be located close to industrial facilities or closer to population centers. Nearby hazards can directly affect the emergency response feasibility. Again, I thank Dr. Leek for introducing this. I had a different example from a challenging multi-hazard situation. In 2020, Hurricane Laura impacted Louisiana near Lake Champlain. There was a chemical facility that was damaged and caught on fire and released a large plume of chemicals, mostly chlorine-based. The staff already had evacuated that site before the hurricane. There was nobody on site to try to mitigate the problem. In one situation, the off-site emergency response said shelter in place for everybody within a 1-mile radius. And then, 30 minutes later, they told everybody within 5 miles to evacuate. And then, 20 minutes later, they returned to shelter in place, which is very confusing and a multi-hazard because you had a hurricane and a facility releasing a hazard that was in the vicinity, and it was during COVID. They did not have a cohesive framework of how to balance these risks to the public. They did not have a tool to balance those risks. So shared infrastructure, shared locations, don't necessarily increase the risk. New plants might be significantly less risk by themselves. They might have a significant lower probability of there being an event. But it does change the decision model of what can and should be done if there is an incident when you have these co-located hazards. So we need a model that lets us consider what those different hazards and trade-offs are. Many people often think that public response is a single value. In reality, response varies significantly across different populations and conditions. Evacuation studies, which are completed for each plant, clearly show that employees, residents, commuters, transient populations all mobilize differently when they're told to evacuate. Behavior also shifts by day of the week it is, what time of day it is, whether there's an event in the area. Even inside these distributions are embedded assumptions. In the ET reports, there are embedded assumptions such as the time to receive the warning, the time it takes for a off-site response organization to decide to issue a warning, the amount of public that will comply with the instructions once they do receive it. And even though those are deterministic assumptions, we still have these large ranges in distributions. Because of this, decision frameworks should represent distributions of possible responses, not single assumed values. Robust decision-making requires evaluating how strategies and protective actions perform across these ranges, whether or not the assumptions are correct. We see here a pattern where comparing evacuation timing and potential accident timing. The distribution shown here are the 90% evacuation times across all plants in the US currently. So you can see that every plant, there's a range of the evacuation time it would take across all of the plants. There isn't a single number that you can assume. But if I also cross-map that to the severe accidents from the state-of-the-art reactor consequence analysis study from the NRC, you can also see that there's a range of times that an accident would start to release radiation from a plant. Most scenarios don't release any radiation. Some do, and they have a very wide range of timing. And that also impacts decision-making. The key takeaway is that both response and release timing are uncertain. Emergency planning, therefore, has to perform across this joint uncertainty. It's not to optimize a single scenario, but develop strategies and tools that perform acceptably across all plausible outcomes. In practice, when decision makers face uncertainty, there's a natural tendency to expand protective actions. We often see this during emergency planning drills. If key inputs are uncertain, officials may choose broader actions because it feels safer to do more when there's significant uncertainty. Instead of sheltering, they might choose evacuation. Instead of limiting evacuation under the plume, they may choose to evacuate the entire emergency planning zone. But without a structured framework, uncertainty can simply translate into doing more without understanding the consequences of doing more. Protective actions introduce their own risks. such as traffic accidents, disruption for medically fragile populations, and other secondary impacts. If we take the principle that protective actions should do more good than harm, then those impacts must be considered explicitly. That requires a capable framework of evaluating both sides of that decision. So why haven't we solved this, and what is the EP tool we actually need? One reason this problem persists is that tools we use today address only part of the decision problem. We have operational tools such as Rascal for plume modeling, evacuation time models, and other models. We also have many academic frameworks for multi-criteria decision analysis. I made one. None of them consider the full range of the issues that an actual decision maker in the moment needs to know. There's no cohesive tool. So we don't lack models, we lack integration. But that integration is hard and time-consuming to develop. We need a tool that can consider protective action strategies, population response distributions, release modeling, and other characteristics. Solving this multiple objectives requires a complete decision model, even without a formal more good than harm test in the PRM, but especially if that is put into place. Modern computational workflows, including AI-assisted coding, may finally make this kind of comprehensive tool feasible to develop. This slide simply summarizes the difference between legacy models and a more modern approach. As I said, the NRC has actually started to move towards performance-based, risk-informed EP over the years. But historically, EP has been a bolt-on layer that often relies on a single objective proxy such as distance, dose, or timing thresholds, numbers that can be anchors for decisions such as we must evacuate at 0.01 sieverts, instead of at what point is the risk more important to mitigate versus the potential risk you're imposing on the public. The models shouldn't perform a judgment. They should just provide better, more robust decision-making frameworks for the decision maker. Close with very short takeaways. First, emergency preparedness should be treated as an integrated performance objective that spans design, siting, and operations. Second, decision criteria should be defined before an accident occurs, not improvised during a crisis. Third, protective actions should be evaluated across joint uncertainty that decisions remain robust. You will not have perfect foresight, so robust decision-making is critical. Fourth, protective action risk should be explicitly incorporated into the framework. The risk of taking the protective action is what I mean here. And finally, EP should be designed to remain resilient even under extreme outlier scenarios. The next step is to operationalize them through an integrated decision framework. Thank you.
All right, thank you, Dr. Stein. I would say Dr. Stein focused on us looking things through a different lens, integrating EP into the process early on, having EP as a performance objective, and challenging us to think differently about how EP will look in the coming years. So thank you, Dr. Stein. I'm pleased to introduce our next speaker, Dr. Richard Maurer. Dr. Maurer brings more than 3 decades of experience in nuclear and radiological emergency response through his work with the Department of Energy and the National Nuclear Security Administration's Remote Sensing Laboratory. His extensive operational experience and global training efforts offer valuable window into the realities of emergency response in the field. Dr. Maurer, the floor is yours.
Thank you, Kevin, and thank you, Nadir, for this opportunity and NRC, this opportunity to present some of our training opportunities for international community. For over 20 years, Department of Energy has been working with international partners on preparedness for in collaboration for responding to nuclear radiological incidents and accidents. We base these training courses and workshops off of our standard practices we use here in the United States. We look at it as an opportunity to share best practices with partner nations around the world to try to prepare countries, especially developing countries, to have the thought of developing a nuclear emergency response capability for a variety of incidents and accidents. We can tailor these workshops to a country's individual needs. We focus on operational response for incidents and accidents. And it's designed for first responders, law enforcement, emergency managers, and regulatory agencies. We use best practices both from the United States and from the International Atomic Energy Agency, which are used around the world. We also do train-the-trainer courses so they can train their own populations. The types of areas we provide workshops on have been drawn from requests from partner nations around the world. A big one is search and recovery for lost or stolen radiological material out of regulatory control. We also work on aerial radiological surveys for plume deposition for nuclear power plant accidents. Over the last 30, 40 years, we've worked with the NRC and other government agencies in the United States to develop capabilities to respond rapidly to a radiological release from a nuclear power plant accident or a radiological dispersal device. My office at Andrews Air Force Base, Maryland, which is about 20 miles south of Washington, D.C., is the home to both a helicopter and an airplane with state-of-the-art radiation detection systems on 24-hour notice to respond to nuclear power plant accidents. We use those training techniques and we share that with our partner nations around the world. We also have a similar set of aircraft at our Las Vegas office in Nevada to cover the western part of the United States. One of the big questions we get asked about is there's radioactive materials moving around the world in cargo containers. The U.S. government has a big effort to put radiation portals at countries' shipping ports and borders to prevent these materials moving around that could be hazardous and used in threats. So we've developed courses to adjudicate radiation alarms on cargo containers at ports and borders. Another big focus here is consequence management. What happens if there is a terrorist radiological dispersal device? What's the next step? How do we respond? And we've conducted many trainings on that as well. One of the big opportunities now around the world is how to do nuclear security measures for a major public event. You may not think of it that very often, but all the major public events in the United States now have a nuclear security plan associated with them. And we have DOE responders and other government agencies providing radiation monitor during these events. And as you're aware, with the World Cup coming up in the United States, we've been working with other countries, Mexico and Canada, as well as the 77 games that will take place at 11 stadiums in the United States. So major efforts this year on major public events. As countries grow around the world and develop, they want to host their own major public events. So we've been teaching and training with the IAEA in Vienna, many countries to provide nuclear security for their major public events as well. We do radiological plume modeling that has been mentioned here by the other panelists. The NARAC system based in Livermore, California is the national program for radiological plume modeling. We do public health and safety and medical advice for consultation in radiation, sickness, and injuries. Some of our advanced workshops are shown here. The picture of the ship you see there. We've often been asked, how do you search a cargo ship for radiological materials that might be smuggled into the United States? So the Department of Energy has developed unique techniques to respond to a ship potentially carrying radioactive materials. And you can see in the upper right-hand corner a map from Fukushima. Some of the DOE assets working with NRC were the first on scenes to produce radiological maps using helicopter-based and airplane-based radiation detection systems. That particular event was approximately 500 hours of flying over 2 months to map out the deposition in Japan. And then we do other trainings at shipping ports, at major public events, and we continue to grow our advanced training courses as more countries ask for these advanced workshops. Our partnerships are developed through innovative in-person and virtual training courses. We work very closely with the International Atomic Energy Agency in Vienna, especially their nuclear security and safety, for reactor safety, and also for lost sources, material out of regulatory control. We had bilateral agreements to do trainings. We've worked very closely, for example, with Brazil, working with them for nuclear security on the World Cup and the Olympics, and many other countries as well. We work with the IEA's Incident and Emergency Center. That's where the information comes in for international emergencies. And we work with their Nuclear Security Division on lost sources. We've developed these courses starting out with a basic course about 25 years ago. And as countries took that course and they got better and better with the techniques, they asked for, what's next? What do you have? So we introduced them to major public events. One of the highest requests from the IEA receives today for security support is on major public events. How to do nuclear security measures at a major public event. Quite a few requests for that. We teach a workshop here in Washington, D.C. On major public events with the IEA every September. It's one of the most popular courses we offer in the United States. We also have advanced courses on that gets into more advanced radionuclide identification and assessment. So we do offer a variety of these courses in series. They've been developed over the years. And one of the things that I heard on the plenary this morning was how do we convince young scientists, engineers, software developers to get involved with this community, with the NRC, with DOE and other agencies. We've seen this effectiveness of these types of international workshops where people will attend our workshops and then we'll see them years later and we ask them, say in Vienna at a conference for the IEA, and ask them, what are they doing now? They've all moved up. They've enjoyed this work from the beginning when they started learning it, and they got really good training and workshops through their years, and they've stuck with it. And they've become leaders, future leaders in their countries. And so we see the effectiveness of training courses. We try to do as many of these as we can around the world. Again, all of our responders in the U.S. are experts, are the experts we use to teach these courses. So it's a very effective way to promote the business and keep people interested in what we're doing. And just in summary, we have been conducting these workshops, so there's multiple benefits. As I stated earlier, not only do we help developing countries increase their experience to respond to radiological emergencies, incidents and accidents. But we're also promoting the next generation of emergency leaders around the world and in the United States. Most of our responders in the United States for Department of Energy are volunteers. They have full-time jobs at our national laboratories, and we add a little bit of training, about a month of training per year, to train them on these specialized workshops that we conduct, and they become international instructors and go around the world and help us. So we want to thank everybody for supporting these workshops. I know we have a lot of international partners here at this workshop, and we appreciate your support. Thank you.
All right, so he's definitely living that theme of collaboration, working across organizational boundaries and barriers. So thank you, Dr. Maurer there. I say reach out to him for training on a variety of activities. It does remind me of FERMAC as I was sitting here looking and thinking about what they bring to bear. But he highlights the importance of readiness, coordination, and continuous learning. So thank you, Dr. Maurer. To round out our panel, I'm pleased to introduce our final speaker, Mr. Rick Rolling himself. Dr. Todd Smith, in his role at the NRC, has deeply involved in shaping emergency preparedness policy and advancing new approaches that reflect the evolving reactor landscape. Today, he will walk us through research and policy developments that have brought the NRC's emergency preparedness program to where it is today, and he will share how the agency is continuing to move forward to meet the needs of tomorrow. Please take it away, Dr. Smith.
Thank you for that introduction, Kevin. Never going to give that up. And it's my pleasure today to be sharing the stage with our distinguished panelists. These have been fantastic presentations, certainly very thought-provoking. But one thing that it reminds me of is that preparedness is a continuous process. It's not a one-time effort. And this means that we cannot rest. As a regulator, preparedness demands that we get in motion and that we stay in motion. And we are a regulator in motion. When I say that we're in motion, I don't mean we're ready to take some small steps forward. I mean we're rolling, and we're not slowing down. And I'm going to talk today about how we're rolling into the future of emergency preparedness. But I think to start, it's useful to reflect on how we've changed in the past to see where we're going in the future. If you look into our history, what you find is that the changes in EP all stem from responses to significant events. 3 Mile Island, Chernobyl, Hurricane Andrew, terrorist attacks on 9/11, Fukushima. They all led to changes in how we prepare for and respond to emergencies. But what I also find interesting when you dig into the details is what changed. In each of those cases, what we found is that there's some unique capability that was missing. And so this gives us a key into what we need to do to prepare for the future. Effective emergency plans are built around capabilities to achieve a desired outcome. Now, one of the ways we achieve that at the NRC is we have a prescriptive regulatory framework in which we identify what those capabilities are that are needed for a particular facility or material type. And that works, it's great, but we can improve, and we have. Another approach is to anticipate the risks and hazards of a facility and to develop flexible capabilities under a risk-informed framework. And then we can use performance-based aspects of the rule to maintain capabilities and to ensure that continual improvement is built into the process. So whether you take a prescriptive or risk-informed approach, the outcome is the same. And this is the other key to our future, because if the outcome doesn't change, this means it's not going to change in the future. But what can change is how we meet that outcome. To that end, our EP staff has been working very hard at meeting the demands of the Nuclear Energy Innovation Modernization Act, the ADVANCE Act, presidential executive orders, and considering stakeholder feedback in how we meet our mission. And we're not done there. Last year, our commission approved rulemaking to address public protective actions in a general emergency and to ensure that protective actions do more good than harm. So we are rolling, and we're probably moving faster than you may even realize. Now, I heard an interesting comment by our chairman this morning. He made this kind of the same remark. He said, we're making thoughtful decisions at an incredible pace. So you may be wondering, how is it, with all that's on our plate, we're able to move forward so efficiently, so quickly? And I'll tell you, it's because we've learned from our past. But learning from our past doesn't mean that we respond in the same way. We're moving forward not because we're reacting to the events around us. We're moving forward because we're ready. And being ready, not reactive, is not just talking about how we respond as a regulator. It really speaks to the essence of emergency preparedness. EP is a continual state of readiness. Now, there's many aspects to that. One of the things I picked up on Dr. Stein's slide, he talked about decision science and the people-centric nature of EP. And this is very true. I like to think of it, too, as proactive risk management. We need to identify ways to manage the risk and not avoid it. But we're left with many options for this. There's many strategies for managing risk. Listed here are 3 common ones you may be familiar with. There's precautionary, discursive, and risk-informed approaches. One strategy isn't necessarily better than the other. They all have their uses, but there's differences that we need to be aware of. Now, a precautionary approach is used when consequences and uncertainty are high. When we have little science to guide our decisions, we often err on the side of caution. It's a reactionary response, and we all know what this looks like for many types of emergencies. But we also understand that this type of strategy can lead to protective actions that do more harm than good. By contrast, we can use discursive strategies when the risks are low, when we have time to gather information, when we can combine local expertise with our science to arrive at a decision. We use those discursive approaches. But in an emergency, that may not be the best strategy because we need to make timely decisions in the face of uncertainty. Well, that leaves us with risk-informed. And risk-informed approaches make use of the best available information in a robust, transparent, repeatable process to arrive at a decision. When you think about our current protection strategies, you can see that they're really a combination of precautionary and risk-informed approaches. We have predetermined prompt protective actions, but we also risk-inform them. We think about things like the evacuation time estimate to decide whether it's better to evacuate or shelter. We consider impediments to evacuation and whether or not it's a rapidly progressing scenario. But I think we can go further, and certainly the characteristics of small modular reactors and advanced reactors provide the opportunity to embrace risk-informed protective action strategies. And understanding EP as risk management, I think, is essential to realizing the full potential of a risk-informed, performance-based regulatory framework. I'd also say that understanding EP as risk management will help you to understand the role of the emergency planning zone. Now, there's a lot of discussion around emergency planning zones that mostly center on how to calculate a size. When you go to the literature, you'll find plenty of papers that discuss sizing an EPZ, but there's two things actually they all miss. Number one, most of these papers never actually talk about protective action strategies or decision making, nor do they make it clear what the relation of the EPZ to the planning is. So I wonder, have you ever stopped to really think, what is the EPZ? Certainly, it's not a physical boundary. It doesn't stop radiation. It's also not a capability. It offers no inherent protection. The EPZ is not an assurance of safety against some quantitative measure of risk. And yeah, we can put a boundary to an EPZ, but that boundary doesn't stop us. It doesn't prevent coordination. It doesn't limit the response or our capabilities. So what is it? The EPZ is a risk-informed planning tool for dealing with uncertainty. And to understand these points, you really need to understand the nature of emergency, because the nature of emergency is uncertainty. And there's a big difference between operating under risk and operating under uncertainty. In a radiological emergency, we don't operate under risk, we operate under certainty. And Dr. Leek painted that picture for us. Responders aren't confronted with probabilities, they're confronted with uncertainty. Unknown source terms, incomplete information, rapidly changing events, and unknowns about what's happening. So early response decisions must be made using emergency plans that were designed to deal with uncertainty. And this uncertainty never goes away, and so this is why we have EP. I've said this at the RIC many times, and I'll say it again. EP is the answer to uncertainty. And this means that uncertainty is carried forward into the emergency planning zone concept as well. And so we need to not shy away from that. Now, that being said, I do understand the challenges of addressing a risk-informed emergency planning zone. Again, when you go to the literature, you'll find many attempts to kind of circumvent this uncertainty by applying risk-based cutoffs, or some methodologies go to the extreme of using worst-case scenarios. Others use unrealistic dose criteria. The challenge I see with those methods is that they all seek to avoid uncertainty rather than address it head-on. We're a risk-informed regulator. And so what we've done, in keeping with our principles of good regulation, is we worked to provide further efficiency, clarity, and reliability in our guidance, and help you to understand how to make risk-informed judgments in doing EPZ determinations. Now, one of the studies that we recently completed, I'm showing here, is a sensitivity study of dose distance calculations. And we use that to inform those guidance updates. And the point I want to make about it here is just to emphasize again that the EPZ is not an exact distance, it's not a particular boundary, and there's always going to be uncertainty. But acknowledging that uncertainty doesn't mean we need a bigger EPZ. I like another thing I saw on Dr. Stein's slides. It said, do more is not a solution to uncertainty. I agree with that. What we need to do is get smarter in how we deal with this uncertainty. And again, I don't know if you caught it this morning, but our chairman made that same remark. We need to get smarter. And I think that to that end, risk-informed protection strategies enable us to make informed decisions in times of uncertainty. But this means that we need the right information and insights to be able to put it into practice. It means we need to get smarter. And the NRC has been leading research and innovation in this area. At the 2022 RIC, we had a session called Exacting the Science of Emergency Preparedness. We talked a lot about evacuation and sheltering, but we weren't done there. Just that same month, we published a study where we looked at max modeling improvements, our consequence analysis code, and how we can use those modeling improvements to improve on protective action decision strategies. And this is a very useful report if you're looking to improve your decision strategies through modeling. The other thing we talked about a lot a few years ago was those non-radiological risks from evacuation and relocation. We know evacuation carries some risk of harm, and so we've been looking more into how do we make effective use of shelters. Now, interestingly, conventional wisdom suggests that you shut off ventilation during a radiological emergency, but it turns out that modern building structures with their heating, ventilation, air conditioning systems work to protect the indoor environment. And so in 2024, we published a literature review that looked into how can we use HVAC systems to our benefit in a radiological emergency. And this ended up being a collaborative effort with the Department of Homeland Security, and we have a joint report that share lots of insights in how to better use shelters to protect against a radiological release. And how many of you have been giving thought to potassium iodide lately? Because we have. One of the things we did 3 years ago is approached our Federal Radiological Preparedness Coordinating Committee to restart a KI subcommittee and examine what should KI policy look like for advanced reactors. To that end, the NRC has been very busy in producing information to help inform the policy. Last year we published a literature review that looked into current distribution strategies, it looked into KI effectiveness, and it looked into the lessons learned from real events. We also did a study to make sure we understood how the KI model and our max consequence analysis code works, and we're soon going to be publishing the results of a study that we did with the max code to look into what makes an effective KI strategy. And we're also refining the work that we've been doing on the effectiveness of wearing a mask. And we found that wearing masks, which is a habit that the public readily accepts, is very protective against inhaled radionuclides. Combined, the NRC has established a very substantial body of evidence that we can apply into risk-informed protective action strategies. But here comes the challenging part. Now comes the work of operationalizing it and putting it into practice. And so we want you to be aware of the science behind our regulations so we can put it in these risk-informed methods into application. And we're not done there. We've been making significant gains in exploring the use of artificial intelligence in emergency preparedness response. I'm going to share real quickly 3 examples. In one project, we looked at using neural networks for predictive emergency response. We used the results of our NRC's state-of-the-art rapid consequence analysis to train a long short-term memory network to identify accident progressions and release timings into containment. And as part of this effort, a group of students at Purdue developed a system that would track key plant parameters to make these predictions. Another group improved upon this model and considered mitigation. Combined, we have a tool that can identify release and no release scenarios. Such a tool could be very useful in deciding whether to evacuate or not, depending on what's going on at the plant. We also looked at how we can improve the tools that we currently use using tools like fuzzy logic. So the response technical manual is a method that has 4 different models for estimating core damage state. And what was once a pen and paper process was turned into a digital tool a few years ago to automate these processes. Well, we envisioned something a little bit different. We thought, what if we took these models and embedded them in a digital twin and then use fuzzy logic to combine the outputs so that we get a single best estimate core damage state. Such a tool can automate data processing and analysis, and that frees up decision makers to focus more on mitigation and response. And finally, because everybody loves their large language models, we're looking at how we can improve them and use them to improve on our risk communication. As one example, Dr. Leek and I just looked into the use of sentiment analysis to improve risk communication. Now, sentiment analysis tools are widely used to look at public opinion, customer feedback, and they have been used in emergencies to examine how the public is reacting. But we identified a novel use case. You can use these tools to help craft your messages in near real time and refine your messages to make sure you're meeting risk communication principles and communicating well with the public. And so we have a paper coming out in very soon in a future issue of the Journal of Health Physics, if you're interested in that. And we look forward to continuing sharing our work. With what we're doing in AI, we're seeking to, again, further the strategic goals of our AI strategic plan. And sharing this type of information is very important. It speaks to the heart of collaboration. Emergencies are too complex to handle alone. And as Dr. Leek mentioned, trust has to be established before the crisis hits. Collaboration, it's not just a helpful suggestion. It's actually the mechanism by which we take complex, uncertain information and turn it into timely protective actions. So we need to collaborate across all levels. At a local level, NRC regulations make sure that our licensees are coordinating with off-site response organizations. Now, if the emergency planning zone extends beyond a site boundary, then our regulations are clear what capabilities are needed for the off-site plans. But even if the facility has a site boundary or no EPZ, that doesn't mean there's not an off-site plan. There's always an off-site plan. And so there's still continuing communication, coordination, and collaboration that's required. But this raises another interesting question. If we don't have a standard to be applied to the off-site plans, what should those plans look like? And this is a question many of our communities ask. And so as part of our collaborative efforts, the NRC, we've been working with our federal partners to develop guidance for states, locals, tribes, and territories to develop emergency plans to support advanced nuclear in their communities. We've also been working with our federal partners to make sure that our federal resources and capabilities are ready to support advanced nuclear. And across borders, we seek to share our risk-informed, performance-based approach with the international community. This includes collaborative efforts with the United Kingdom and Canada in ensuring licensing efficiency and emergency preparedness, and an ongoing technical exchange between the US and Japan to strengthen our preparedness and response capabilities. 15, 20 minutes is not enough time to share with you the tremendous amount of progress we have made in getting ready to employ risk-informed performance-based experts in just this last year. I'm sharing this information with you so you can dive deeper into these topics. I also want to point out that most of these studies were released in just the last year. This is how intentional we are in moving forward. Finally, to conclude, we're not just here to meet the moment. You hear that a lot at the RIC, but we're here to prepare for the future. As preparedness specialists at the NRC, our actions today meet our current needs, but they shape our regulations, they inspire innovation, and they strengthen our collaboration for the future. We move forward because true preparedness isn't measured by how we respond to what has happened, but by how ready we are for tomorrow. Thank you.
All right, thank you, Dr. Smith. I think he focused, I'm going to start where he left off, collaboration with the focus on trust, the use of AI in decision-making, making strategies to protect the public, informing protective strategies, and making sure that we can do it from an operational perspective, and lastly, dealing with a level of uncertainty. So thank you, Dr. Smith. And at this time, I would like to extend our sincere appreciation to all of today's speakers, starting with Dr. Leek, Dr. Stein, Dr. Maurer, and Dr. Smith. Each of you have brought a unique and valuable expertise to the discussion, and you've given us a deeper understanding of the progress that has been made, not just domestically, but also internationally. And then we looked at the challenges that we'll have to navigate through in terms of emergency preparedness and the opportunities that look ahead and that we're prepared to be able to roll into the future. So we are truly grateful for the time, your thoughts, and your experience that you have shared with us today. So much appreciation on my behalf and behalf of the NRC. So thank you for that. With that, I will now transition to our Q&A session, and the first question I have is for Dr. Leek, and it is, given the information you presented and the message of considering all hazards, not just radiological, do you think the current threshold for evacuation of one rim teddy prescribed in the 2017 PAG manual is high enough?
All right, great question. So I think that if you listen to how we frame today in looking at how to inform our decision-making during protective action decision-making, we need to look at more than just a number, right? So I'm going to skirt that question on whether that number is right or wrong, right? So there isn't a right number. There are numbers that can give us a radiological risk assumption on cancer induction or other types of health effects. But that number alone isn't valuable unless we can measure it against what the risk of the other action we'd be asking, whether that's evacuation or sheltering or whatever the public protection is, and whether we're asking the public to do it or the public does it on its own because of their understanding of radiation. So I think Dr. Stein talked a bit about that as well. With, how do we have a tool that can take all of that into account? So we're not just looking at a number and we're not basing an action on a radiological risk alone. We need to look at the whole picture.
All right, thank you. The next question is for Richard Meyer. The DOE brings unique technical capabilities to national response efforts. How do you see DOE's role evolving as emergency technologies and new reactor designs begin to enter the national landscape?
Thank you for that question. We're continually advancing our detection systems for nuclear power plant emergencies. As I mentioned earlier, we have just acquired brand-new aircraft, helicopter, and airplanes, both East and West Coast, which shows a commitment to producing state-of-the-art equipment for any type of reactor accident. We do practice that routinely at both locations, doing large area deposition mapping. So I think we're trying to stay ahead of the game. If you were in one of our helicopters or airplanes flying the survey, we simulate the data that would be on the ground, so it looks as real as you can get, and the team responds according to what they're seeing. So we're trying to stay ahead of the game. We're prepared to produce background surveys for new power plants, as we've done in the past, and to provide baselines, but there's a lot of work that we could do as these new systems come online.
All right, thank you. Next question is for Dr. Todd Smith. What is discursive that was on your slide, and how should we be looking at that and applying it in our processes?
Great question.
Get a hold of that.
Oh, okay. Yeah, discursive from the Latin or the Klingon, I don't know, discourse, right? It means talking it through. I'll give you an example of it. The ICRP has a process they call the co-expertise process. That is an example of a discursive strategy. It means that we don't just make a decision now, we take some time to think about it. We engage the public, we take their feedback, we listen to the experts locally and consider their insights before we make the decision.
All right, thank you. Question for Dr. Stein. What regulatory or institutional changes do you believe would have the greatest impact on supporting a flexible, risk-informed emergency preparedness framework?
Implementing. Maybe the light just isn't lining up. Great. Implementing the new updated NRC mission that considers efficiency and benefits to society, which would ultimately trickle down to considering all hazards risk, I think that is the number one thing that can be done to improve the regulatory process. So implementing essentially what has already been voted on by the commission, that is the frontier of how to move forward.
Thank you. We have another question for Dr. Leak. Could real-time air radiation monitoring in the evacuation pathway community around a nuclear reactor provide objective data to both assuage public concerns when there are unusual events with no release, and also a powerful tool to intelligently execute a shelter-in-place or evacuation action in a real emergency with radiological releases?
Absolutely. Anytime there's a question of a radiological release, proving zeros or proving background is going to be just as important as actually measuring the amount of radiation that was released. And so if there's the ability to have real-time measurements, that was always beneficial. We use models to try to get an idea of what's happening, what's coming out of the plant, so RASCL and some of the other things that we use, but those are just models. And until we have field readings to know what's really out there, we're guessing on those models. And so the faster we can get that real-time information, and for the new plants where we are saying that we're modeling that there won't be any measurable or risk from radiation off-site, showing those zeros is just as powerful as showing an actual measurement.
Thank you. Back to Dr. Stein. How do opinions that, kind of get the public up in arms about nuclear energy impact the ability to effectively prepare and respond in a radiation emergency?
That's a great question. So public response, as I mentioned earlier, is not just a single number. We put a number of, say, the amount of public compliance you have when there's an alert and a warning of what to take as a protective action. That can change significantly if there's significant, say, anti-nuclear opposition that has the public very fearful of it. They, instead of listening to the protective action that the experts have deemed would be optimal potentially with robustness, they could just decide to do their own thing. And that could be way more risky to them and their families or other members of the public than if they listen to the protective action. So trust, as has been mentioned several times, is very important, and anti-nuclear opposition doesn't just affect the trust of the plant, it also affects the trust of decision makers in an emergency.
Kevin, I'd like to respond to that question as well. This is one I get very passionate about. And I agree with everything that Dr. Stein said, but I'd like to also add, there is a significant body of evidence of how we know how the public responds in an emergency. We're not operating in a vacuum here. And just assuming that because it's a radiation emergency means the public is going to panic is false. Not only is it false, we've known it's been false for years, but somehow we keep repeating this. It's a myth. And we have to stop repeating these myths or we cannot move forward. What we know from our research is that the public trusts what they're being told, and they will listen to authority of what to do in emergency. So it's very important, again, that you establish yourself as a trusted agent and as a good partner before the emergency happens, because the public will listen. And what we also have to do is give our decision makers and the public complete information. We don't need to hold back. They're not going to panic. They want to know. When we have emergency, it's built into human nature, so why fight it? We go into information-seeking mode. We need to give people complete information so that they can make protective action decisions to benefit them.
Thank you, Mr. Passion. All right, back to Richard Maurer. Dr. Maurer, from your experience in both domestically and internationally, what do you believe has the greatest opportunity or impact on our ability to shape the next generation of response tool or training or partnerships?
Thank you for that question. And as I mentioned in the presentation, we find that there's a lot of benefit to conducting these workshops both in the U.S. and around the world, because it is promoting the next generation of future leaders. We have evidence for that just as they move up within their regulatory agencies, their Nuclear Regulatory Commission system or DOE type system, they're becoming leaders. So I would encourage more of these type of training courses. I know we're limited on how many we can do a year, but they are effective and people really enjoy them. It gives them practical experience in a unique field that they may not have opportunities to work in that in their country. So they're learning advanced techniques, advanced procedures that will benefit not just their country, but all countries around the world.
Thank you. Do you want to add anything? All right, this question is for Dr. Smith. Scalability, what does that look like to the public?
Boy, you just give a whole talk about being prepared, and then you get a question that you're not prepared for. Rough crowd. I'm going to flip that. I'm just going to say, is that what the public's looking for? Because again, I would say that's not what the public is looking for. What they're looking for is to know that you have a plan. They don't care how big your emergency planning zone is. They want to know there's a plan in place that you're going to let them know when you have an emergency and when they need to take an action. That's what the public is looking for, and that's the assurance they need.
Thank you. Dr. Stein, would you like to weigh in?
So I agree with what Dr. Smith just said, but I think that there's a communication problem here also, where some new deployments of advanced nuclear reactors that are proposing site boundary emergency planning zones, it is being assumed that means that there's no plan, that the plan is all on site. And that's incorrect, but that's when there's a site boundary emergency planning zone, it sounds like the only planning is occurring inside the site. And so that communication, that framing is important for the public to understand that there is a plan off-site too.
So Dr. Leak, I'm going to ask you to chime in terms of building on what Dr. Stein said there. Where do you see the benefits of communication, and and when should we be communicating?
Yeah, I think that, when you use the term scalability, it's not different than risk informing across all of the different hazards. So we are going to scale our action, whether that's a site boundary or a protective action of a mask or whatever that is. We're going to scale what we're asking the public to do based off of the totality of all of the hazards. And so I think that communication needs to start now before there's anything coming out, and it needs to happen both to the public but also to those responders. I think I mentioned, in my speech earlier, that if the responders and the decision makers understand what options they have, how it fits in the bigger picture, they can help to second what's actually coming out and what's happening. And so when you're trying to explain why an action is necessary this time but not next time, or last time we did it like this and this time we're not doing it like that, they understand why there's scalability or changing recommendations. And so we have to communicate now and throughout the entire process of production, use, and emergencies.
I'd like to just add on, because EP has historically been an add-on, as I mentioned earlier, this is a big challenge with licensing right now. We have pre-application engagement for years, usually, for an applicant. And we do have members of the public attending some of these meetings, which is great, I think. And we have developers reaching out to communities and having town halls, which I also think is great. But then they say something to at the town hall that maybe the NRC doesn't agree with in the licensing application. And so the community feels like they're getting two different things. Because the EP is being looked into or considered and finalized later in the process, instead of maybe up front where it should be, because the community needs to know that you have a plan for protecting them up front when you first engage with them. And so I think that this needs to move forward in the regulatory engagement process for particularly developers to think about, so they can engage the public more wholeheartedly from the start.
Yeah, and that just triggered a thought for me as well. So, it's the developers, it's the Department of Energy, it's the Nuclear Regulatory Commission, and it's everyone involved in this, especially this early advanced nuclear engagement with sites. So just because it's not a fully operational facility yet, or it's not going to be generating anything for years, the construction, the dirt's being moved, and we heard that this morning, that success means shovels in the ground. Well, even if there's no radiation being used yet, the shovel in the ground is a very visual piece of information for that community, and if they don't understand what the eventual risk could be when those shovels are going in the ground, that can raise a lot of questions. So as much information as can be shared as early as possible is really important, no matter who's putting the shovel in the ground.
All right. Well, I think we're at a point where our time is up. As Carol Burnett would say, I'm glad we had this time together. But hey, I really want to thank the panelists for their candor, their forthrightness, their insights, their perspectives. I believe most of them will be here all week. If you want to catch them off the margins, please do engage them. I would like to give them a warm welcome, and thank you, not a welcome, but a thank you for their insights and perspectives. So thank you very much. All right, thank you. Thank you everyone for staying. It's late. Enjoy the rest of your day and evening.